Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and here we take a stock of India's fight against COVID-19. Now, today is a very special day, being the 74th Independence Day, and we are celebrating that. The most significant aspect is the Prime Minister's speech, in which he made several references to how we have so far fought this battle against COVID-19 pandemic, be it in terms of scaling up our testing technologies or making, indigenously making PPE kits or ventilators or even N95 mask equipments, which are very crucial to this battle against COVID-19 pandemic. Also, he has spoken about how the focus from here onwards will be boosting the health infrastructure in India and making use of digital technology as well. Therein comes the National Digital Health Mission. So we'll be looking at all these aspects and we'll be talking about all of them in detail. And for this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with, we have Dr. Samiran Panda. He is the Director and Scientist G at ICMR. We're also joined by Ms. Urvashi Prasad. She is a Public Policy Specialist at NITI Aayog, focusing on health and health infrastructure aspects. Also, Dr. Puneet Misra is with us, Professor with the Center for Community Medicine at All India Institute of Medical Sciences. Welcome all of you to Rajya Sabha Television, and once again, many hearty wishes on the 74th Independence Day. Let me begin with you, Urvashi, and let's start directly looking at the points which were made by the Prime Minister specifically regarding the battle against COVID-19. And the most important amongst them is how we have scaled up our testing strategies and testing technologies from 300 per day to 7 lakh per day.
Yes, thank you, and a very happy Independence Day to you and your viewers. Yes, I think he made some very important points, and he brought out really the self-reliance that he's been talking about in the context of the healthcare sector and the pandemic, where in many areas we are now not only able to make enough for ourselves, but we've even been able to export to other countries in need. So yes, in terms of the N95 and the PPE kits that he mentioned, we almost had negligible, domestic manufacturing capacity right at the start of this pandemic. And so it's very noteworthy that just in a short period of time, we've been able to gear it up significantly. And of course, a lot of this has happened through partnerships with the private sector. I think it's really important to highlight that a large number of organizations in the private sector have done phenomenal work, including startups, have come up with so many new innovations which have been made right here in India. We have robots now which can sanitize public places, which can deliver food and medicines in isolation wards. So I think these innovations are really commendable. On the testing, as you mentioned, even till as late as March, we were hardly being able to do 500 to 700 tests per day. Now we've gone up to 7 lakh a day. We're trying to ramp it up even further to 10 lakh a day or even beyond that through the use of course, both rapid antigen tests as well as the RT-PCR. And again, this has been enabled a lot by the public-private sector collaboration. We have a large consortium which has been set up of scientists, of private sector players, of government agencies to ramp up the indigenous production of the rapid antigen kits, for instance. We want to produce at least 100 lakh of these in a very short period of time. So I think this has been a very important aspect that he's highlighted. And on the vaccines as well, I think, the fellow panelists will talk more about that. So I won't go into the details, but it's important to say that we're not only doing new research, but we're also gearing up our indigenous manufacturing for vaccines so that wherever in the world a suitable vaccine does come up, we can actually be very quick to manufacture the requisite doses for our population. So I think it's both, make in India as well as make for the world. And I think those are, aspects that we've really seen play out in the healthcare sector during this pandemic.
Okay, make in India and make for the world as well. Vaccine obviously is a very important part, but we'll come to that later. Let's first focus on the testing strategy and different kind of tests we've spoken about and discussed most of them on our show here, be it the RT-PCR test, rapid antigen test, or several others which have been, built or developed rather by our own scientists and researchers here. Dr. Panda, I'd like to bring you in here in terms of, the strategy against COVID-19 pandemic has always been test, and conduct more tests, as well as trace also. So in that sense, we've done really well. The way Prime Minister, pointed out, from 300 per day to 7 lakh per day is one aspect. Then also ensuring that protective equipments for our health workers are manufactured indigenously only. And as Urvashi pointed out, this is not only for our health workers, but it's also make for world. We are also exporting now these equipments.
Yes, absolutely. And there are 3 T's: test, track or trace, and treat. So the treatment has also ramped up quite a bit. And there, the main emphasis has been drawing upon the evidence, evolving evidence, because this is a new disease and it's a pandemic situation and an entity that human civilization and the scientists didn't have much knowledge about. So it's new knowledge coming in, an incremental increase of knowledge that ICMR frequently draws upon and then informs the policy and the program. So that's a great thing which is happening now. And that has happened due to the close collaboration between ICMR and the Ministry of Health and Family Welfare. That's one thing which I would like to highlight or underline. The second thing is, it is not only just the public and private partnership, but also interministerial collaboration. For example, you did talk about tests. In order to do a test, one has to take a swab. All of us know, nasopharyngeal swab. But those swabs are being produced in huge number because there were interministerial collaboration. And this has happened, this has been possible only due to the help of Ministry of Textile. So I see a great deal of collaboration within the ministries happening. And in terms of tracking or tracing where the infection is going, there the participation of the people have been very important, have played a great role, but it has to happen much more. In the sense, while the vaccine is being prepared and is being tested out, the best vaccine as yet in our hand is our own prevention or preventive behavior. So it is not only the change in behavior, but the sustained change. We might, observe protective behaviors for a few weeks or during probably the lockdown period. We are very aware, but slowly, this is known. This is very human. We go back to our old practices or behaviors. So sustaining behavior change is an issue that not only comes as a responsibility of the government in terms of campaign, but also people's involvement in people's health. So I would say that apart from the hardware part of it, the software part, particularly the behavioral aspects, and how do we underline it and how do we achieve the sustained behavior change is again very important. And India is really doing great in terms of the mask usage going up, the testing which has gone up, and also the treatment which is being regularly updated. So if there is an evidence or evolving evidence that something which we thought would work but is really not working, then we are quick. We have been really very quick in changing our treatment policy. So these have been the major highlights by which India as a country is fighting the epidemic and fighting it in a great way.
Okay. So it's a dynamic situation, and as Dr. Panda pointed out, evidence-based strategies or policies are being made to go ahead and deal with the situation here. Self-reliance being one of them. Let me bring in Dr. Puneet here. Dr. Puneet, your views on the strategies being adopted against COVID-19, and as the Prime Minister highlighted some aspects of those strategies, and the focus has been making India self-reliant, be it in terms of developing, testing technologies or equipments like PPE kit or even vaccine candidates. There are 3 vaccine candidates which are being worked upon right now in different stages of trial, as the Prime Minister said.
Yes, and if you see his speech today, he has focused a lot on COVID, besides many other health issues. Here, first I'll talk about the COVID, the points which he has raised. And as my co-panelist has already pointed out in the terms of the number of tests which we were doing in the initial phase and what's our condition right now. Whether again in the area of PP kits and then the behavior and the other steps which have been taken by the government, different ministries, healthcare workers, and other people. Besides that, there is one very important message. What I see here, what our Prime Minister has said about the vaccines. He said that there are 3 vaccines they are under trial, at least in the country, indigenous vaccines. And as soon as we get a green signal from the scientists, see what he has said, the green signal from the scientists, we are ready, our infrastructure ready, everything is ready. So the important message is here. Although we are waiting for vaccine, we are doing everything best, but without a green signal, I mean, like what you have seen in the, Russian vaccine, there's a lot of, debate going on whether they have scientifically tested it or not. But here, when we talk about the Indian vaccine, he is very clear that once the scientists they give the green signals, meaning thereby that when we, complete the test as per the scientific vigor and the scientific ethics, only then we will go ahead. Mm-hmm. Number 1. Number 2, he has said about the infrastructure. See, that's called the planning, right? Suppose scientists say, okay, now our vaccine is ready. So do you have the capacity? Do you have the infrastructure to distribute it in a very minimal time? I think Prime Minister has addressed one very important issue here is that our infrastructure is ready, our manufacturing capacity is ready. You just say, yes, the day when the scientist gives them the vaccine, okay, sir, this we have tested, this is safe, this is effective. I think within a matter of days or weeks, it would be available in the whole of country and vaccinating 1.3 billion population. It's a huge challenge. Our population is second largest in the world. So that is a huge challenge that he has pointed out. The other thing, as my co-panelists have already spoken about the number of tests. So here, not only the number of tests which has been increased, I mean, when it started, probably in initial phase, we have number of tests in 2 digits, not even in the 3 digits. And now if you see, very soon we are going to cross 1 million point. I mean, that is a big achievement for the country. The other big achievement is, at that time, we were totally depending on other countries to get the kit to develop the test. Now there are many things which are indigenous, which are available. I mean, these things, it takes a lot of time, lot of, patience, and our scientists, they have proved it. Again, okay. ICMR has taken the lead. I mean, if you are following this news and you are covering Corona since very beginning, what we have seen that ICMR has taken lead into it, that they, license the labs, those who have capacity, and do not compromise on the scientific vigor. So that because it's not easy, it's not something which you can, but that is again scientific thing, industrial thing, the coordination and indigenous, without compromising on science. I think this is the biggest achievement and that our Prime Minister has pointed out.
Okay, there is no compromise on quality out there, as Dr. Puneet is pointing out. Dr. Panda, I'd like to bring you on one aspect before I go to Urvashi, something which, Dr. Puneet mentioned in terms of vaccine development. The most important aspect obviously is ensuring that a vaccine is in place, and that is something which obviously researchers and scientists are working on. But once we have the vaccine, the next big challenge would be ensuring not only that it is produced and in large quantities sufficient enough for everybody, but also the distribution of the vaccine out there, something which has been referred to by the Prime Minister, that our plans are ready and in place out there. Once we have the vaccine, we can easily ensure that every Indian has an access to that particular vaccine, and perhaps maybe we will help other countries across the world as well.
Yes, in terms of vaccine, India is actually doing multiple things together, which is the right way to go. While on one hand, India did organize very recently, in the recent past, an international symposium where all the gurus, the vaccine experts, the vaccinologists, the scientists, internationally and from within India, they exchanged ideas, asked questions. So it was kind of listening exercise and exchanging notes. So while that happened, within the country, India did look into the initiatives or the efforts that are ongoing, and Honorable Prime Minister did refer to that. and he did talk about 3 vaccine initiatives. While one of them is indigenous in nature, and one of the ICMR institutes, the National Institute of Virology, which is located in Pune, this has played a key role in terms of isolating the virus. If you want to, there are different kinds of vaccine platforms. For one, which uses inactivated whole cell lysate or the vaccine, there you need to get access to the vaccine. And the National Institute of Virology has really played a key role in virus isolation and handing it over to the technology and the company for taking it further forward. So that is a second achievement. So something which is happening within the country.
Okay.
Moreover, we are also very carefully thinking of 3 things. One is tolerability, another is efficacy, and the third is the memory. Memory, we cannot know after giving the vaccine how long the effect will stay, because the time can only say. But in terms of tolerability, it is about safety. And the efficacy, that is what is being tested now. So it is not just the animal experiments. India has done not only small animal studies, but also primates, non-human primates. And that is a huge thing. Now, internationally, if you go, any good initiative, a serious initiative,
okay,
would go through these steps, and India is moving towards it. So there is something exciting going on within the country, and at the same time, India is very well connected and is exploring how collaboration with the other companies which are developing vaccines internationally, for example, Oxford vaccine, which everybody talks about, is also very much in the discussion.
Mm-hmm. Okay. Dr. Urvashi here. Let me bring Urvashi. Urvashi, when the time comes, how significant or important you think would be not only sufficient production, but also equitable distribution of the vaccine which will be in place whenever it happens?
Yeah, I think that is, obviously one of the most important things, and it is challenging given the size of our country, the diversity in our health system. Every state is obviously at a very different level of development of its health system. So those are undoubtedly challenges. But I think given that, in this particular case, we are seeing a large number of stakeholders actually coming together, of course, within the government, at different levels, across, different types of ministries, departments, different research groups coming together, and also the private sector, because we are seeing collaboration at a scale like this. Along with a lot of, international agencies, various other types of organizations, which can really help us to then reach out to everyone so that, no one is left behind. And I think that is something that has been a very clear philosophy that the Prime Minister has also put out, that we wanted to reach everybody, as and when something scientifically credible and proven is available. We want to be geared up to ensure that really no one is left behind, especially the most vulnerable. We do know that there are so many sections of the population which are especially vulnerable to COVID. And so we have to ensure that, all these constituencies get it. And I think it is through these large scale collaborations that we'll manage to eventually achieve that.
Okay, and let's now come to one more point, Urvashi, and a very important one which the Prime Minister mentioned in his speech, although we have discussed that in detail, earlier. That's the National Digital Health Mission. But to bring it back to the viewers, it's really, really important and significant how technology will be used for the benefit of the common man and in the health sector, and how it might revolutionize or transform the entire health infra which is in place right now, and obviously the benefits will accrue to the common people out there.
Yes, absolutely. I think digitization and most importantly, integration of health information. I think this is where this is really headed towards. Today, we have a fairly fragmented sort of healthcare sector. We have a large number of private providers. We, of course, have the public sector. And this is an effort to really bring all of that together on a common platform. So that every individual can ultimately have a comprehensive health profile, which can be used across providers, across schemes, across programs. At one glance, you can see, does this person have any comorbidities? Have they had any illnesses in the past? So it can really help your surveillance efforts, your research efforts. And I think ultimately it is about bringing all the information on one platform. So ultimately it's going to be not about just the health identity or the identity card, which will of course be critical, but you will have services like telemedicine, you will be able to consult doctors, you will have e-pharmacy eventually, everything on one platform. So I think it's digitization and integration, which is a very important health system enabler. It is obviously not a substitute. We need to provide universal health coverage. We need to provide public and primary health care, hospital-based insurance, all of that. But to enable all of that, we need digitization. We need integration of health information. And today has been sort of the first step in that direction with the official launch of this mission.
Okay. Dr. Puneet, as Urvashi is pointing out, your views there that digitization and integration of health data or health services is an enabler, sort of a top up of what exactly needs to be done on the ground.
Yeah, I think it is a very important step which government has launched today. Our honorable Prime Minister has announced about this mode of digitalization, because it's very important. I mean, for common public, let me explain it in more layman terms. What would happen? What was happening that people, they were not having their records. They were going to doctors and they were not having investigations. So many times it becomes difficult when you have the national repository where you can access your record anywhere. Suppose a person who lives in Delhi goes to Chennai for anything and becomes sick, right? Doctor asks, okay, what were your previous investigations or other things? They don't have access to it. But if they have the national digital system anywhere in the country, and I think anywhere in the world, if you give the password, if you give the access to the healthcare provider, they can access your record. That is number one. So now it will be with the health system, your records, they are whenever you are in the hospital or in the healthcare facility, your records, they are available. So this will improve the treatment. This will improve, the adherence. The other thing, as Dr. Urvashi has already pointed out about the e-pharmacy, what happens? I mean, this will stop the use and this will enhance other things. Like what happened? As soon as the patient comes and they say, okay, from which pharmacy you get the drug? Here you write the drug, you go to that pharmacy, you get that quantity of drug. So it reduces the misuse. I mean, what's happening? Suppose if you write antibiotic these days, a person can take number of 5 days antibiotics from one chemist shop, move to another, again take. But when you displace them, you can stop this misuse. The third is about the research. This will provide a bigger research platform where we can do a lot of research, which would ultimately improve the quality of healthcare. And I think this is one of the biggest steps. Few people here, I'll take few more seconds.
Okay.
Many they feel that, okay, what would happen? I mean, your privacy. So I think with your consent and the privacy things they are in, I have seen in the US. When I was working in the US, I was getting training there. It was so, I mean, unless you give the access, you have to give as I'm a user, I have to give the access to the healthcare system or to the provider. I'm giving my consent to this provider to see this part of my treatment or this information they can access. So that way it can be protected. I don't think there will be issues. This will bring, no doubt this will bring a huge change, and this would be like another revolution in the healthcare system in the country.
Okay. Let's have concluding comments from Dr. Samiran Panda here on the National Digital Health Mission and various benefits out there, as both Dr. Puneet and Urvashi is pointing out. Your views, Dr. Panda, before we bring this to an end.
Digital health is the way forward. It is a great tool or weapon, but it really needs to have people's participation in it. So the trust of the people, because there are a whole lot of apprehensions around it as well. So while we all know the strengths of the digital health approach, now people's participation in this would solve a great deal. And then the delivery of care in difficult terrains, underserved population would be much more easier. And then, of course, here the research, as Dr. Puneet said, would directly feed into the service delivery decision making. So that's why I think it has been a great announcement by Honorable Prime Minister today. But now the implementation, that's what we need to do in order to have this dream getting fulfilled.
Okay, there it is. Thank you so much, Dr. Panda, Dr. Puneet, and Urvashi there as well for sharing your views on various aspects with regards to India's fight against COVID-19 pandemic, which were highlighted by the Prime Minister, and not only the present situation, but also the future scenario where use of digital technology in boosting our health infrastructure or digital health, as Dr. Panda pointed out, is the way forward from here onwards. We'll keep on bringing you all other details with respect to what is happening on a daily basis about the COVID-19 pandemic. Meanwhile, you take care of yourself. Do not step out of your houses without a face mask, because that's the best protection we have as of now against this particular disease. And once again, from me and my colleagues at Rajya Sabha Television, many happy Independence Day.